Hello everybody, welcome back to my channel, and today we're going to be talking about testosterone, what every man needs to know about that very important hormone that shapes your life. First of all, we want to know where's the testosterone made. It is made in the testicles, mostly in the testicles, but as a side gig, we also have some made in the adrenal gland. It starts with cholesterol. Yes, you heard me right. Cholesterol is the same molecule that people say they're worried about their arteries and they take a pill for reducing it. So it is the raw material that makes all your sex hormones. Here's the trivia. Men produce about 7 milligrams of testosterone daily, right? So it's a very small amount. Only 1% of that is free floating and ready to do the action. So 7 milligrams, 1% of that, which is very little, is circulating in your bloodstream to flow and do the job. So, what does testosterone do? Everybody thinks of it as a muscle builder, but no, it is like your Swiss Army knife for your body. So, it sharpens the muscles and the bone, fuels libido, sparks red blood cells in production, tunes also your mood in brain function. So, it's very important for cognition. It is the leadership hormone and the feel good hormone. No wonder it's a controlled substance. So, did you know low testosterone is linked to increased risk of depression and osteoporosis? And occasionally, men are given those medications, but really, if they can supplement with testosterone, everything will be fixed. Root of the problem. So, normal levels and daily rhythms. Normally, the testosterone at men at an age of 19 to 36, they produce about 264 to 916. Talking about a big range, right? So here's another twist. Testosterone follows a daily circadian rhythm, meaning it peaks up in the morning and it slowly drifts down. That's why you guys have morning erections. Another trivia, the morning labs are very important. I like to draw the labs for men probably 9 or not later than 10 in the morning because that's your highest T level. So literally it's very important to check the levels early in the morning to make sure that you're getting the right results. How is the testosterone controlled in this body? It's a very complicated system. So think about it. The hypothalamus, which is a center in our brain, sends a signal to your testicles through an axis. This hormone is called gonadotropin releasing hormone. Then it goes to the pituitary and says, release LH and FSH to other hormones that are important that go to pump the testes. And then some testosterone comes out of the testicles, but also flips into DHT, dihydrotestosterone, the supercharged testosterone molecule or hormone that also is responsible for hair loss. So you don't want too much of that as well. Another thing, testosterone turns into estrogen, especially if it's in high doses taken exogenous by, enthusiastic doctors giving 200 milligrams injections. A lot of that is going to be changed to estrogen. So yes, you got to be careful because that causes man boobs. So testosterone is not the only sex hormone. We will learn later in life there is DHT, dihydrotestosterone. DHEA is another precursor of testosterone. Also, testosterone ends up doing estrogen at the very far end and estrogens that are not good for your prostate. So it's very important to have the balance. And the very first molecule that makes it, yes, you said it right, is cholesterol and vitamin D. So these are important hormones that we know that we need to balance them all for you to have a healthy lifestyle. So did you know male's brain actually needs a bit of estrogen for normal sexual health? So when we find men with low libido, we check for estrogen and also another hormone called prolactin. Next, we go to the symptoms that we have and signs of low testosterone. So here's the checklist. First, low sex drive. I would say also morning erections are gone. Fatigue, you're always tired, you want to take a nap in the afternoon. Low mood and even up to depression. You're less motivated, it's the leadership hormone. Belly fat, that's what happens. Belly fat, and then belly fat will also make estrogen. Weak bones and even anemia, that will also cause fatigue. Anemia is like low hemoglobin. But the diagnosis is symptoms plus 2 labs. Very important. Separated different days in the morning. And I would tell men also, do not get your labs done if you didn't sleep well, if you were sick prior, if you had surgery. You want to take it when you're in a healthy place, you didn't drink and party the night before, and you had a good night's sleep. Also did not exercise like crazy in the gym. So another trivia, did you know testosterone deficiency affects up to 40% of men over 40 years of age? Natural boosters for testosterone. We're going to talk about that before jumping into prescriptions. So let's talk about the science-backed up natural strategies. Of course, exercise is very important, right? Exercise is so key. Lifting weights is very important. Losing the belly fat is another very important one. It's because fat will convert to estrogen as well. Sleeping 7 to 9 hours. One bad week of sleep can drop your testosterone 10 to 15%. So also sleep is very important for your cognitive health and executive functions of the brain. That's another study. 7.5 hours, they find people function better, and they tested the brains with MRIs. Now, it's very important also to fix your deficiency, because if you're low on zinc and very important vitamin D, which is the molecule that starts the whole sex hormone production, it's very important to fix those deficiencies. Now, here's the trivia. One night of sleep loss can cut your testosterone down to 10 to 15 years of age, which is hard. So make sure you're having your good Z's. Now I'm going to talk about herbs that can increase your testosterone. Herbs that can increase your testosterone offering natural alternative to TRT. And they are really very easy to get. So just be very careful with the side effects like prostate issues. So getting them online, you need to do your proper research. We will focus only on the herbs that have evidence on randomized clinical studies and that have been published. We will cover top 3 proven ones like Ashwagandha, Fenugreek, and Tongkat. Ashwagandha is a very old, ancient Indian Ayurvedic adaptogen, meaning it is adaptogen. It goes up and down as you need it, like fixes, balances, using it mostly for stress reduction and vitality. So clinical studies showed that 10 to 22% increase in the serum levels of testosterone in overweight, stressed, aging males after 8 to 16 weeks when they took 300 to 600 milligrams of that capsule. Another meta-analysis showed that study showed that the sperm's quality and hormone balance in improving men's infertility. Mechanism, it reduces the cortisol, which is your stress hormone, and suppresses testosterone. Fenugreek is a seed. So seed extract is popular, and it is very important also for libido. Clinical evidence in studies showed that it is significant for testosterone rise, 46% in the free testosterone. In the free, which was 1% of your total, in resistant trained men after 8 weeks taking 500 milligrams of fenugreek. Improved sexual function and reduced age-related androgen decline, which is the decline of testosterone that happens with aging. The mechanism, it inhibits an enzyme that converts testosterone to estrogen, so it keeps the testosterone in its place for longer. Tongkat, that's a cool one. Southern Asian root. It's like ginseng, or it is a ginseng from Asia for men vitality. Clinical evidence, systematic reviews, and meta-analysis has been showing that 14 to 37% increase in total testosterone in healthy and in aging men after 4 to 12 weeks, 200 to 400 milligrams of that taken daily. Safe for long-term use, enhances fertility and energy. Double bonus. Mechanisms, it boosts the LH hormone, the luteinizing hormone that is sent by the brain and releasing to stimulate the testicles for testosterone production. Now, hormone replacement therapy, that's what I do every day for men with symptoms and confirmed with 2 lab tests. So you have to have both. You can't give people based on one-time random tests with low testosterone. And they have to be healthy, slept well, didn't eat any junk food, and no much alcohol. So you want to have that and a good day. Testosterone replacement can restore your energy, libido, body composition, mood, and bone health. Delivery methods, we usually do gels, creams, patches. They even have oral now, and injections. I'm not a big fan of pellets because they are large doses that usually it's not a good get you some side effects. And we always monitor the hematocrit, the PSA, and the hematocrit is your how can thicken your blood, right? The hemoglobin and hematocrit, so it's a blood draw, and PSA is a blood draw to monitor your prostate. And any symptoms also is monitored every 3 to 4 months. I see my patients. You can't just disappear for a year. So how do you improve your hormone replacement therapy? Is by taking physiologic dosage, not a high dose, meaning like you're not taking large dose of testosterone that can cause side effects, move into estrogen, increase your DHT, and break down your hair. So you need to go to somebody who knows how to do that proper balance and not give you a high dose. So here's our trivia. TRT safety trials, they found that testosterone didn't raise major heart risk compared to placebo when it was taken in a healthy dose. So young men and testosterone, I would like to caution you. You should not jump straight into testosterone. Shots or gels are absolutely not a good thing for you. Why? Because in, up till 40s, exogenous testosterone shut down your own production. So the factory will not work, like hitting pause button on your testicles. So can lead to infertility, low sperm counts, and that's why I would call it like the chemical castration. Instead, younger men used different strategies. That's what we use for them to stimulate their own natural production. So the goal is to keep your own body working. I like these peptides, kisspeptin or gonadotropin releasing hormone. These are analogs that can be given as injections, and some of them are given weekly or every other day to wake up your hypothalamic pituitary axis and get the testicles stimulated. Another way, if you don't want to get shots, clomiphene or Clomid, it is a prescription, and it also boosts your LH and FSH so that your testicles continue to work. HCG is another therapy that has been used for fertility. It mimics your LH. That's the hormone that goes from the brain to stimulate the testicles. Now, quick questions that I always get. I thought I'll put them down there. Does TRT cause prostate cancer? It's a very common question, and that's why men are worried about it. No clear evidence when monitored and when given in the proper doses, but screening matters. It's very important to screen for PSA and exam. Like ultrasound, sometimes we do MRIs. I'm not doing the prostate exams as much. Can it thicken my blood? Yes. We watch for hematocrit for that reason, and we see this happen when somebody is taking high dose of testosterone. It's not a common thing unless if you're taking a dose that can cause a side effect of clotting. So if you're having high red cells and hematocrit, then you want to talk to your doctor, make sure they reduce the dose. How soon will you feel better? This is different between everybody. So mood and energy, I get people calling me next day, thank you doc, I feel amazing. Sexual function maybe improves in weeks. Muscle building and bone takes also months sometimes, and you have to have your proper proteins, the builders, right? The Lego blocks, and also to make sure that you're exercising and lifting. That's how it works. That's shown by clinical studies. Can also, a question that I have here, can it increase my penis size? I would say no. Early on, the sex hormones increase the size of the penis in young people until they reach puberty. But I would say it might increase your erection size, because if somebody's having ED because of low testosterone, then they will have better erections, which not a flaccid penis, and when they're erected, they will have better performance. So here's the game plan. Track your symptoms. Get 2 morning samples. Fix the lifestyle first. And if truly having low testosterone, see a qualified doctor for HRT. Stay strong, stay curious, and remember, testosterone isn't just for the muscles. It's about quality of life. Want to personalize the plan? Just visit drbarx.com. Subscribe to my channel, please, and thank you so much. If you have any comments or questions, leave them below. And hopefully this was informative.